Hello, my name is Lisa Rodovich, and I am a DNP student at East Carolina University. Today, I would like to talk about health information exchange, some federal and state legislation and barriers related to health information exchange, and some recommendations going forward in its use in North Carolina. So what is health information exchange, or HIE? According to Dr. Johnson from Vanderbilt University, it is the mobilization of healthcare information electronically across organizations within a region, community, or hospital system. The term can describe the concrete give and take of patient health data across electronic platforms or between providers, more conceptually as the idea of the fluid movement of health data as it changes hands, or in reference to the organization or entity facilitating the transfer of information. The primary function of an HIE is to permit access to clinical information on demand at the point of care. HIE allows healthcare providers to securely access a patient's personal medical information electronically to get a complete snapshot of a patient's health history. It improves the speed, quality, safety, and cost of patient care. HIE helps facilitate coordinated patient care among disciplines, reduces duplication of tests and procedures, and may help avoid costly mistakes. In addition, other benefits of HIE are improving the quality and safety of patient care by reducing medication and medical errors, improving public health reporting and monitoring, reducing health-related costs, encouraging appropriate use of new technology and healthcare services, and providing the base for technical infrastructure that can be used by national and state-level initiatives. There are three types of HIE. The first is directed exchange, which sends and receives secure information electronically between care providers to support coordinated care. Also, there is query-based exchange, which allows providers to find and/or request information on a patient from other providers, often for use with unplanned care, such as an ER visit. And finally, there's consumer-mediated exchange, which allows patients to monitor and control the use of their health information among providers. So let's discuss some federal legislation related to HIE. In 2006, the Health Information Security and Privacy Collaboration, or HISPC, was established by the U.S. Department of Health and Human Services. It was founded to assess variations in privacy and security policies and state laws that affect HIE, propose practical solutions while following state and federal laws, and develop detailed plans to implement solutions. Its goal was to review high-priority areas where multi-state collaboration could encourage the development of replicable solutions. In 2009, the Health Information Technology for Economic and Clinical Health Act, or HITECH, was developed to provide each person in the United States with an electronic health record. In addition, a nationwide health information technology infrastructure was developed so that access to a person's EHR will be readily available to every healthcare provider who treats the patient, no matter where the patient is at the time treatment is provided. In March of 2010, as part of the HITECH Act, the Office of the National Coordinator for HIE, or ONC, awarded funds to 56 states, territories, and qualified state-designated entities as part of the State Health Information Exchange Cooperative Agreement Program. States and state-designated HIE entities received nearly $548 million through this program, whose goal is to fund states' efforts to rapidly build the capacity for exchanging health information across the healthcare system, both within and across states. Those receiving this money are responsible for increasing connectivity and enabling patient-centric information flow to improve the quality and efficiency of care. In January of 2011, an additional $16.3 million was made available to states through the ONC's Challenge Grants program, which provides funding to states to encourage breakthrough innovations for HIE that can be leveraged nationwide to support interoperability. In April of 2011, the National Governors Association published a report in an attempt to address HIE privacy and consent issues arising from lack of guidelines and standards for HIEs. In September of 2014, representatives from the Health Information Management Systems Society wrote to the HHS, stating the necessity for an interoperable platform for HIE as one of three key policy levers to focus on in accordance with the Meaningful Use Participation Timeline. Some barriers on the federal level may include privacy and security concerns, lack of standardization across the country for HIEs, and the cost of federal funding for these exchanges. Another major barrier is a lack of transparency and reliable information about health IT products and services, which may reduce the opportunities to advance interoperability. So here are some state legislation aspects. In 2015, legislation passed by the North Carolina General Assembly directed that the North Carolina's HIE be transferred to a new authority under state control. This authority is known as the North Carolina Health Information Exchange Authority, or the NCHIEA. This group oversees and administers the state-designated HIE. State law requires that all healthcare providers who receive state funds for the provision of healthcare services must connect to NC Health Connects to continue to receive payments for the services they provide. Hospitals, physicians, and nurse practitioners who provide Medicaid services and who have an EHR must connect by June 1, 2018. All other providers of Medicaid and state-funded services must connect by June 1, 2019. At this point, there are no costs associated with subscribing to Health Connects. Currently, the NCHIEA is funded by the state of North Carolina. Eventually, fees related to the use of value-added features may be added, but they will be vetted thoroughly with all stakeholders and recommended to the General Assembly. Some EHR vendors may charge fees to their customers for the connection to NC Health Connects. The NCHIEA is serious about patient health data privacy and security. They follow strict HIPAA regulation and state laws to protect patient privacy. Data cannot be sold. It is protected, stored, and accessed only for permissible purposes under federal and state law. Also, there is an opt-out form that patients can complete and submit to control if or how much of their health information becomes part of this database. Some barriers to the state HIEs may include the quality and completeness of clinical data, as not all providers transmit data to HIE. Privacy policies for patient data sharing may also affect the completeness of data. There are also concerns about sustainability, and some organizations do not rely on grant funding, while other organizations still depend on state and federal grant funds. Those that are sustainable depend on user subscription fees to pay for operating costs. After completing my research on HIEs in North Carolina, I have a couple of recommendations for making it a continued success. First, as DNP prepared nurses, we have the background and knowledge to work actively with our representatives and other elected officials to help define what HIE is, as well as foster communication, coordination, and suggestions for strategies that will support the roles of our state-level HIE entity. As our nation moves towards a more technologically advanced healthcare system, we need more highly skilled health IT experts to support providers in the adoption and meaningful use of electronic health records. Another recommendation that I have is to encourage the use of workforce development programs that will train new health IT professionals to help providers use the HIE and EHRs to improve healthcare quality, safety, and cost effectiveness of healthcare. Thank you so much for listening to my presentation.